Good afternoon, good morning, good evening, depending on where you are. On this tumultuous planet wrapped in a pandemic and an infodemic, I've been resuming these Earth Institute calls to try to cut pathways through all the noise and connect people who might normally not get connected in conversations that lead towards solutions. This is not a fix it kind of a problem. Like most of the problems we face today, actually, it's complicated. And every school system is different. Every school is different. Every kid is different. Every family context is different. Unfortunately, opportunities are incredibly different. Our schooling is so much a function of history of where you live and how you live, of race, of poverty, that there's no way to have a simple answer to.
Eddie,
Here's Erwin. Yeah, Erwin, I see you. You are now on camera. You're on our.
excellent.
You're
Good.
online.
Okay.
Uh,
I can't change this right now.
there
Yeah.
are a couple more people are going to come on this show today. It's a 2-hour show,
Yeah.
unusual for here. Erwin Redliner is a pediatrician who's been working for decades to limit risks and to promote the recovery of kids, particularly when they're facing a disaster.
Yeah.
And here we're living in the ultimate long disaster. It's kind of an ongoing thing. Like climate change will have these characteristics increasingly, but this pandemic is unique in so many ways. So, Erwin, a couple of
Sir.
days ago, you were in a webcast, a town hall, and I'm going to
Yeah.
shows people some screens from that. Basically, asking the question: how do you have school safety during a pandemic, and how do you have
Yeah.
child safety? So, what's your top line? Like when you think, I'm sure you get peppered with these questions all the time, right?
Yeah.
And I'm sure you have to somehow say, well, let's dig in, and because it's not like wash your hands, right?
Yeah. No, it's not. And I think the first thing is that what we all ought to uh, recognize that this whole question deserves a whole lot of humility because nobody's got the right answer. And I've said many times, except for the extreme right wing governors who don't really just following the Trump line, for people that are trying to make an intelligent decision about something like reopening schools in a pandemic, this is an agonizing situation and question that we really don't have enough information to make an intelligent decision about. So we're left with a chief executive, a mayor, or a governor, or the head of a school system trying to say, we will or we won't, or it'll be all remote, or it'll be a hybrid, or all classroom. That is a profoundly important decision that will affect, I mean, there's 55 or 56 million children in pre-K through 12th grade in the United States. So this is a vast experiment,
Right.
not a controlled experiment, but where we're subjecting children to some way of getting them back into the educational trajectory, which they desperately need. And so that's it. So whatever I'm going to say to you is with the caveat that things could change. I was first of all opposed to reopening the schools. I'm still kind of opposed, but also feeling the need to have kids get back to school. And so I've been recommending, yeah, okay, let's do it and make sure we've done every precaution. But if you ask me, do I expect the schools to remain open? The answer is no, I don't. So yeah, we're going to give it a try, but I fully expect in 46 weeks after we open the schools, we'll be closing them again because they'll become hotbeds for exacerbation and resurgence of the outbreak
Right. And again,
in New
and
York
there'll be different,
and
and whether
elsewhere.
it's in New York or other areas, you're going to see these pop up flare ups that will make it very tough. There's no
Say
like,
again.
you'll see
Yeah,
these,
yeah.
you'll see pop up kind of flare ups, right? In other words, you'll
Oh
have
yeah,
decisions that have to be made at different levels: the level of the school, the level of the district, the level of the state.
yeah, yeah. And the parents, don't forget,
Yeah.
and the kids themselves have an important voice here. And I testified in a New York City Council hearing yesterday about this issue. And it was sort of heartbreaking, first of all, to hear a couple of 16-year-olds from disadvantaged communities in New York speak so passionately about what they need and how disappointed they were that the system wasn't paying attention to them. It was a stunning and articulate expression from kids themselves, which I think we need to pay
Wow.
attention to also. But so, Andy, here's the other thing: there are three hotbeds right now that could potentially rekindle the outbreak at much higher levels than we're seeing, and those three are what is happening on the university and college campuses around the country, which is a
Right.
horrendous number of young people getting infected, many asymptomatic, but a lot of them still getting sick. Secondly, we have the right now going into the Labor Day weekend, which is going to be an opportunity for people to get together, unfortunately unsafely sometimes, and
Right.
restart things again. And the third thing, of course, is the reopening of schools. These are the things that I am personally worried about, like right now, and we'll have to see how this plays out. But I'm not optimistic about the outcome.
Yeah, and I'm going to bring in. I just saw it, Eric Fegelding, who's at Harvard and at the Federation of American Scientists and Epidemiologists with public health economics background, and who ran for office in Pennsylvania, congressional back. So he knows politics too. And Eric is very prominent on Twitter in discussions of these issues.
Hi,
So
Eric.
Eric,
Hi.
Irwin, this came together very quickly. There are other people I would love to have on here, but here we are. So Eric, we're all facing, as Irwin said a minute ago, you have to have a lot of humility here because complexity, emerging science, the specific characteristics of the virus, right back through to the characteristics of each community, lead to kind of a morass. This Columbia tip sheet, I think, is helpful. I'll show some screen grabs from it in a minute. But what's your first message when you think about this and someone asks you about the
I think
school question?
the first humility is that we don't know everything. Obviously, everyone says that, but the difference is, well, in absence of knowing having perfect knowledge, and in presence of this fog of war phenomenon with this virus, what is your default? The
Right.
default for some is, sometimes back in January, some major international organizations said there is no evidence of human-to-human transmission. So do we assume that there is, or do we assume that there isn't? And same with aerosols. Do we assume that there is aerosol airborne transmission, or do we assume that there isn't? And this is where the scientific camp divides, because some people want to pretend, well, no, don't take any action until we prove it's true.
Right.
But I think there's a real lesson here that over time, repeatedly, we learned that we should have taken a precautionary principle from the beginning, whether it's human-to-human transmission, whether it's aerosols, whether we should have worn masks much earlier, right? I think we should have all done all of these things. And I think with the school, the debate is, well, A, do kids get sick? Yes, they do. Do kids transmit? We don't really know for sure, but yeah, most likely they do. There's so many evidence of it. And so we should basically, especially when it comes to our kids, we have to take the most precautionary principle and most precautionary approaches.
Right. And that seems, we keep missing that lesson. The other thing about acting in uncertainty, this comes into so many aspects of life. And I've written about, we do this all the time in certain contexts. We act in the face of deep uncertainty. We don't know a truck is coming, but we stop at the red light. That's like the most basic example. But, and in disaster risk reduction, Irwin, you've been involved in this wider field of disaster risk communication. I have been writing about it for decades, earthquakes, climate, you name it.
Yeah.
We still come up
Yeah.
against this. And I don't know, maybe this is the politics question, Eric. Our politics always seems better at response than at prevention. Maybe, Irwin, you want to
Yeah.
start with some thoughts on that and where we
Yeah.
go?
So first of all bets are off now. There's been nothing like this, in terms of the outbreak since 1918. But besides that, we are living with a federal government that is basically in a state of delusion, dishonesty, incompetence, the likes of which I don't think we've ever seen in American history. So we can't believe anything that's coming out of the White House or related to the White House, including from the FDA, the CDC, and all the other relevant organizations, we're left in a serious quandary of confusion. And so, like when Trump is pushing for the release of untested vaccines, maybe in October, but certainly before the election, that's preposterous and it's blatantly political. But if it wasn't just political and there was actually a way to be comfortable with the vaccines, we have no way of distinguishing the political agenda about his reelection and the actual science. So he's been so undermining of science and evidence and everything that we are taught to believe in that we're left in a horrible quandary right now. You know, believe me, and I think I mentioned before, but I am not at all envious of people who have to pull the trigger and say, I'm making a decision, we're opening or not opening the schools. And they're making this decision knowing that the evidence is scanty, that they can't depend on the typical federal agencies, and the rest of us are left in really just a state of anxiety, which is why we wanted to put out that report. By the way, the co-author of that report is driving. That's Karen. And so we were both. Karen was actually on the mayor's advisory committee for reopening schools, and so we're just scratching our head and trying to figure out what is the action that needs to be taken, because no action is not an option. We have to do something.
Yes.
And
So
that's where we are.
I'm going to show folks a couple of the graphics from the tip sheet that you guys put out, and we can walk through that a little bit. This is broadcasting live on Twitter and Facebook and all over the place. So hold on a second while I switch to the next slide. So there's the cover sheet. This came out just a couple of days ago. The links are there for anyone who wants to following this on one of the social media platforms. So first, there's the school, right? What do you need to know about the school itself? This is sort of the triage. And Eric, we were talking a few minutes ago about ventilation, for example. Is there a basic question a parent can ask in deciding on that first step, like my school, let alone hybrid or other blah, blah?
Yeah, I think it's a combination. First of all, you need to know the background transmission in your area, and not just statewide, but in your city and region specifically.
Right, and that's the report says this right here. Does the outbreak seem to be under control in my city or my county?
Your school. This is where it's vague because, first of all, does the school have mask policies? Secondly, what is the policy around lunchtime when everyone takes off their masks to eat?
Right.
And the ventilation issue deals with aerosols. And what we first have to establish is aerosols are not just droplets droplets are what we call the ones that get pulled down by gravity, ballistic action. But the aerosols stay in the air for anywhere from 20 minutes to 4 hours to even longer. And those kind of things, basically distance is almost, with a lot of people, distance to a certain person is almost not a relevant factor. Mm-hmm. There was actually a bus study of monks, and the people infected, 23 people on this bus got infected, and there was no correlation with, in which the proximity of sitting to the infected person was on the bus. Everyone had almost an equal chance of being infected. And that just shows the power of aerosols. And so the problem with that now is to get rid of it. You either need really good ventilation. In environmental health, what they say, the solution to pollution is dilution, unfortunately. And it's here, the solution to aerosol transmission is dilution via ventilation. Mm-hmm. And the problem with that is sometimes they recirculate the air. Like for example, in some AC systems, to save on heating costs, they recirculate the pre-cooled air instead of drawing in hot air from the outside all the time. Right. That saves in heating costs, but by not drawing in fresh air, you actually are at increased risk. And we actually saw this in the Dutch nursing home study. There was 7 wards. 6 of the wards have pulls in fresh air, while one of the ward recirculates the air. And the ward that recirculates the air, there was a very, very high attack rate, while no one else was infected in the other wards. And so altogether, I think this aerosol question leads to schools. Do you have enough ventilation? In some schools, by the way, you can't open windows or doors because the school shooting security
Right.
policies, lockdown policies. And so, well, if you can't open the windows or doors, what's the AC system like? Does it recirculate the air from the outside? If not, does it have UV sanitation? Probably not. If you
Right.
don't have that in the HVAC system, then you should have a filtration system in the middle of your room in your classroom. Probably they don't have that either, to be honest. And also,
Right.
by the way, many classrooms in America are interior classrooms without windows whatsoever. So altogether,
Yeah.
this offers incredible amount of challenges. And in the school lunch problem, some people propose we'll just have different separate lunch periods, and then the kids will pod or cohorting within each lunch period. But the problem is, A, kids take off the mask, and B, if you're sharing the same lunchroom, but having lunchroom session A, B, C, but there's aerosol transmission, then the aerosols from lunchroom group A will easily go to group B and C.
Right.
Do you see that problem?
Right.
It's a serious problem because anytime someone takes off masks, and we know taking off masks is actually related to infections on airplanes. It's just, the question is, how do we solve it, right? We need
Right.
funding. We need, at minimum, maybe PTA groups can fund a filtration device in each
Yeah.
classroom, a MERV 13 or HEPA filter, but that's obviously costly and only for privileged schools with parents who can afford that. But on a national and state level, we need to fund all this, but there's just no momentum whatsoever. And hence, all this becomes a very difficult challenge.
Right. Erwin, I know you're in transit.
Yeah, I'm now driving. I apologize. Sorry.
Okay.
Probably get to, so, okay, yeah.
Yeah. So I guess that community, what's the nature of the infection rate in your community does seem to be a key question, right? In other words, thinking of it as the school issue is missing the bigger issue. When kids go home, when they're out of school, go back into school, the teachers and the staff are all going back and forth.
Yeah. So here's a dilemma here. So we've been actually living in a bubble for 6 months where children have been home in their homes for the most part and interacting with their nuclear family. That's it. All of a sudden, we're going to release all these children into these congregate environments, into classrooms, and with some schedule or another. And this is going to pose an enormous challenge with no idea what's going to happen. But children who get who catch the coronavirus in school but are asymptomatic are going to go home with as carriers. And it's not just their elderly relatives and grandparents who may or may not be living with them that may be vulnerable, but now the entire rest of the family, including their parents. So even if their parents are not really elderly, and by the way, the age of contracting this virus has been dropping steadily. But if mom or dad is a little obese or has got diabetes or asthma, these are going to be people at high risk, and they may be getting sicker, which is why and how the community spread could happen, probably will happen from children going back to school. So we have a whole series of unknowns that are coming up, and I agree with Eric. It's just, even this issue about the aerosols that Eric mentioned is like, like, what the hell? It's like, we were operating in the assumption a 6 feet distance from other people is fine, but if the aerosol transmission is real, which we have no reason to think it isn't, then we have a whole other set of issues that have to be understood about what do we mean by safe separation and being in closed rooms and so on. Yeah, we have the opportunity for these viruses to be lingering and inhaled for who knows how long here. So, yeah, so everything you say has got some other caveat associated with it,
Yeah.
and that's the problem.
One of your checklist items in the NCDP back to school checklist was about testing, and this again, every issue we were talking about gets back to the profound reality that in this country there are huge gaps in capacity that map with race and poverty. So there really isn't a no one know, you can say is there testing, but we already know where there isn't testing, and it's often based on
Yeah.
income and race. But that does seem to be.
Income and
What would you say
race,
about testing?
Well, testing has been one of the major screw-ups of this administration. We just don't have enough testing. A lot of things are being pushed through the FDA with these emergency use authorizations, and we don't have enough testing capacity by a long stretch. And even when you do get tested, there's all sorts of problems in the getting the results back, and long delays, and it's just very complicated. However, there may be a game-changing breakthrough coming shortly, which has to do with the availability of what's called point-of-care (POC) tests, which will not need to be sent to a lab, can be done with a small sample of saliva or a very gentle nasal swab, and those tests can be read in 15 or 30 minutes wherever the testing takes place. As I said, it doesn't need to go to the lab, and you'll know immediately whether somebody's is positive or not. And that can be done basically every day in a school, for example, testing teachers or students. So I think the bottom line here, and those will be available in, I'd say, the next 4 to 6 weeks. So we'll have new tools at our disposal, and hopefully that'll help making testing much more feasible. The original recommendations from the mayor's office in New York City was that the teachers be, quote unquote, encouraged to get tested at least monthly, which was one of the things I objected to very strongly. Not encouraged. We have to demand testing at a very, very regular frequency to make sure we've controlled potential spread.
That seems to make complete sense. Eric, the testing issue nationally still seems such an impediment to clarity. We all, like Jay Rosen, a journalism professor at NYU, way back in April, he admonished reporters on this broadcast that testing is the story, period. Yeah. And I think it still seems to be a pretty clear cut. It's not the only story for sure, but without that landscape awareness.
The testing, people have different views on testing because, some people, as Scott Atlas misleadingly stated, testing allows you to treat people earlier. As a physician, that's the right approach. But as a public health prevention and epidemiologist, testing allows you to isolate earlier so you don't spread it. That's the main thing that's being missed in the dialogue.
Right.
And, some people saying that, well, this new rapid home saliva, this pregnancy test equivalent approach is less accurate. Yes, it has a lower sensitivity, but what you lose in sensitivity, you actually get in speed in which you can actually isolate people and tell them, if you test them, especially daily, as if you're toothbrushing each morning, you can get a different sense. It's a speed of the feedback. An instantaneous feedback, or near instantaneous feedback, allows people to isolate, even if you miss some. And again, the other thing is PCR test tends to pick up positive tests even after you're infectious, because they've actually done studies. From the moment you develop symptoms, on average, people stop. The virus that you give off is no longer culturable, as in the virus is not, intact anymore to spread after about 11 days. And that means the infection you're giving off, shedding infectious viruses for 10, 11 days, but afterwards, the viruses you're giving off are oftentimes fragments, right? That are not infected. And PCR tests can pick up those as well, which is not the same as infectious. So the key with these antigen and these rapid other tests is you can find them faster and isolate, because getting a PCR test result, assuming it's still infectious, getting it 5, 7, 10 days later is completely useless, because people are not going to literally stay home like a monk during that time while waiting for their results.
Right.
But if you had instantaneous results, then they would isolate like a monk if they truly knew they were positive. And I think that's the main thing. And over time, if you can do five imperfect tests that are 80% as good, will pick up results and that reports results instantly, will pick up way more cases, infectious cases, than a PCR that has delayed 5 to 7 days. And you only do it once. So I think that's a trade-off.
Yeah. Erwin, another point in the tip sheet that I'm showing right now on the screen is on these decision points related to your own child. So you have your school, your community, your policy, and then you have your child. Can you just talk briefly about that? There's no single cookie cutter child, of course.
Yeah, so we've been very focused on what the schools have to do and be prepared for, from the ventilation issues to keeping kids separated, dealing with the issues that Eric was also referring to before about congregate dining and bathrooms. And so in other words, is the school prepared is one set of questions that would influence a parent making a decision about whether to send their kids back to the classroom. But there are other factors, like you just mentioned, Andy, about the what's going on in the community. But then there's the child, him or herself. So let's say you're wavering back and forth about whether it's safe to send your kid back into the school, and the school's doing more or less the right things. But what if your child has special needs that are helped by having special services available? In New York City's school system, which is 1.1 million kids, 200,000 of those children get special services for special needs that have been identified. And so if they're not going to school, many children, especially those from low-income families, are not going to get the service they need. So that could tip a parent toward making a decision to go to school. On the other hand, your child may have certain risk factors, immunodeficiencies or some chronic illnesses that would make them more prone to getting sick if they got the infection. That may tip you toward making a decision to go just remote. So this issue of what's going on with your particular child has not been talked about enough, which is why we wrote it into the report.
Yeah, there's a question that came in from, she's a teacher in Mexico, posted a really good question live right now on outdoor activity. Now, I know I've talked to some teachers and school administrators who run outdoor kindergartens, and Zeynep Tufekci did a really good piece a while back for The Atlantic on mischaracterizing risk outdoors. But at the same time, there are risks if kids are on a playground unattended. So maybe if you could both weigh in briefly on the outdoor option for schooling.
Yeah, I think we should definitely have outdoor schooling. They actually did that, by the way, in the 1917-18 pandemic. Outdoor schooling was actually one of the things that they did. By the way, they also realized masks, and they also realized, airborne transmission back then. It's just how amazing we forget a lot of these things.
Although I remember reading and writing a little bit about the anti-mask league in San Francisco. So there was also pushback.
It is very familiar.
Unbelievable.
History doesn't always repeat itself, but it rhymes.
Does rhyme.
So the outdoor schooling, I think it's a really great idea. Honestly, if the other solution, if we cannot have good ventilation and we want our kids to have in-person schooling, is to have these giant wedding tents for classrooms.
Right.
Honestly. And they can be set up, most schools have a field. You just create like a series of these giant tents in which you teach. Now, obviously, it's not all climate. In the wintertime when it's like below freezing, it becomes a little tricky. But I think it's a very potentially feasible thing. Outdoors also allows you to build fires too in cold weather. Look, we've lived through these tough times, and we've lived through 100 years ago and centuries of without air conditioning or indoor heating. I'm not saying we to return to those, but I think ventilation is the best way. That's the most cost-effective way. Not requiring HEPA filters, MERV 13 filters, or
Hi, can you
UV.
hear me? Sorry, I'm back.
Yeah. Sorry.
Yeah,
It's okay.
and I think outdoors is what we need to do. And maybe not every school can do it, but maybe not every climate. But at least in the fall, we maximize the amount of time we can do outdoor schooling.
I agree.
So, if I could just add something. So, Eric, before I got cut off, I think I heard you talk about the 1917, 1918 influenza, with some places actually doing outdoor classrooms, even in colder climates. For example, in New York,
Whoops.
there were some schools doing outdoor classes, and they got these. Can you hear me?
Yep.
Hello.
Yep.
Okay, and
Go
they
ahead.
got these like incredible hooded blanket garments that the kids could wear and the teachers could wear. So they went all through the winter, and it was pretty amazing. But they were able to hold classes outside. The caller that the questioner that you mentioned, Andy, was from Mexico, so there should not be any problem at all doing outdoor classes for the entire year if that's what they decide
Right.
to do.
Yeah, I'm hoping she can come on later, possibly. Jenny DeRosia asks about other models in other countries. Is there any country that has or is using methods that have proved successful overcoming the enormous barriers this virus has created? Is there a model that the U.S. can replicate? And Charles Rotter, who's kind of a interesting character with a very libertarian streak, says Sweden. And Jenny says, why isn't that model being discussed anywhere? Well, there are a lot of models being discussed. Certainly, Sweden seems to be an interesting and complicated case. They have maybe a less bad economic hit than the rest of Europe, but it's still within.
No, but their economic. I actually post and tweet about Sweden all the time, and first of all, several groups of Swedish scientists. There's a group of 21 and group of 25. The group of 25 epidemiologists says, don't do what we did. What we did is an example of how not to. And they're referencing basically not just the huge number of cases, but also deaths. And Sweden, by the way, has universal health care. So you shouldn't assume what Sweden does is always the best compared to us or other countries. But that's why you should compare to his Nordic neighbors. Sweden used to be merged with Norway. So look at Norway, Finland, Denmark, just across the bridge. And Sweden's mortality is multiple folds, more than 2 or 3. I think it's like close to 4 or 5 fold higher mortality. Right. And it was very unfortunate. And obviously cases are going down for now, but they also realized their mistake.
Yeah, and
on their economic front, another group of 21 economists and other researchers basically realized, their economy is no better than some of the other ones who actually did take precautions. So I don't think Sweden is a successful model, and we shouldn't assume Sweden model will work for the U.S. either, because they have universal health care.
Yeah, that's a point that I've tried to make. We are not Sweden, and even Sweden. This came up in some tweeting and reading I was doing about Sweden and policing during our with the big debate about our police force. Sweden is actually becoming more militarized. Their community, as it becomes more diverse and has more of a rich-poor divide because of immigration, is starting to look more like us a little bit on that front. So right now you can't make these easy comparisons. It's pretty clear. Erwin, the woman Sybil Sanchez in Mexico has offered a clarification. I guess she wants like a best practices thing. And Eric, you kind of mentioned tents, obviously. It says it would help to know any suggestions both for school and for home. We're in it for the long haul, while further in Mexico, for a long while in Mexico, and having clarity around safe outdoor socialization would be so helpful. So I don't know, maybe that's a poster or something to be made.
Yeah, there's a really good rule of thumb in a BMJ. I think Trisha Greenall, she posted something. It's basically, there's several factors, and they all add up to worse or better. And first of all, is it indoor or outdoors? or is there distancing or no distancing? Is there a high density of people or low density of people? And are they whispering, being quiet, or shouting, or are they wearing masks? And
Interesting.
all these things additively, you can imagine, they on an additive scale will actually, you want to avoid the worst of all worlds, as in no mask, high density of people, shouting, indoors, right?
Right.
But if you go to the other end, outdoors, very few people, being quiet, wearing masks, it becomes relatively safe. And in Japan, for example, Japan recognized aerosol transmission from the beginning. They realized and they assumed that it was aerosol from the beginning. So they had really good ventilation. Of course, they have good mask culture, and they also, for example, on subways, they always ventilated, opened all subways. And there's a rule: no talking on subways. So
Oh, that's interesting.
yeah, basically, there's this. Well, it's also partly unsaid in Japanese culture. You're not supposed to be loud, but they
Right.
also minimize your voice, wear a mask, and they open all the windows on the subway cars.
Huh.
So all these things have made a huge difference. And the modeling says if you have all these things, especially with windows open, it's relatively safe.
So I
By
am
the way,
saying, yeah, Aaron.
so I'm just going to say, look, Eric is 100% correct, and you asked the original question a couple of minutes ago: is what could we and should we replicate that other countries are doing that have been more successful, which includes Japan, of course, and South Korea and Australia and New Zealand. And I think, one of the fundamental problems for us is that what we should be replicating is leadership on a national level, and the ability to depend on science to make the correct decisions. And we don't have that right now. So unfortunately, the big macro agenda for us has to do with getting leadership who does represent a dependence on science to make decisions, and to do so with the strength of its science and backed up by evidence. And we are just in a situation where we don't have that, unfortunately. So
And are there governors
that's yeah.
are
Say
there
again. Sorry.
governors are there governors who might not normally be on the progressive end of the spectrum who've kind of led the way that you point to as showing some sensible approaches?
Larry Hogan.
Well, yeah, there's plenty of governors. I think the the differentiation is not whether they're progressive or conservative. It's not that spectrum. It's the spectrum of do I understand and respect science, and am I making
Right.
decisions based on science? And I don't care whether you're an extreme right-wing conservative, but who understands that, or you come from the left. And I think it's not a political differentiation. It's more of an intelligence and understanding that the best decisions are made by following the lead of what science is taking us. That said, of course, as we've been talking now the entire time, there's so much that we don't know, and the whole idea of decision making is very dynamic. Because what we know today might change with new insights, next week. So I think there's a lot of reality here that we need to pay attention to. And but I'm going to have to jump off in just a minute. I'm just arriving at my medical appointment.
Yes, I really appreciate your squeezing this in, and same for you, Eric. And in a few minutes, we're going to switch over to discussion of the news of the week with a couple of journalists who are going to come on too. But Eric, if you have time to stay on a few more minutes, we can talk a little more about some things.
10 more minutes, yeah.
That would be great.
Okay,
Erwin, you
guys.
made a really important point, and thanks for the report and the video. I'm sending them all around
Of
on
course.
the various
Thanks, yeah,
social
we can talk about
platforms.
Thanks, Erwin.
Yeah.
Keep up your
My
good
pleasure.
work.
Bye, Eric. Oh, thank you too.
Yeah, he's on the run to a dental appointment, oral surgery, which I've been stuck with. Everything is backlogged, we're all trying to catch up, those of us who have access to medical care. So, Eric, let's talk a little bit about social media and all this too, the infodemic and how it relates to action and inaction.
Mm-hmm.
I think, personally, I can't find a way around Erwin's argument that leadership consistent messaging.
Absolutely.
In the absence of that, we're basically choose your word.
Yeah. Where it's really frustrating. Federal leadership has been terrible. State leadership has been patchy, some good, some bad, some okay. Um, you know, Florida, I would rank on the lower end of today. They actually are now prohibiting and barring all local health officials from reporting number of students and teachers who are infected and how they're infected. It's really terrible. And of course, Georgia, which banned any local city ordinances from implementing mask mandates. And I think Nebraska did too as well. It's terrible. So to the infodemic issue, there is, early on there was hydroxychloroquine, right? And no, early on there was also it's just the flu. And then there's the hydroxychloroquine. And then there's the mask denial that says masks don't work, or masks is oppression. There's the crazier pandemic crap, and then the oleandra crap peddled by My Pillow guy. The list just goes on, and then of course more recently the 6% thing, where only 6% of the people who died didn't have risk factors, therefore they must have died from someone else. That's kind of like a meteor dropped on a city and killed 10,000 people, but only 6% of them didn't have other risk factors, so the meteor only killed 6%. Everyone else just died from other causes because they had risk factors. And so it's a very nonsensical thing, but it's been picked up. Like Senator Joni Ernst of Iowa actually repeated that. She said about 10,000 actual deaths, which is basically 6%. And also that doctors are overbilling on purpose just to juice their numbers for more money. And that was a double conspiracy theory. But she's a sitting member of Congress.
Right.
And Iowa, I remind you, has one of the worst per capita epidemics. Iowa right now is like the new hotspot. It's one of the worst per capita cases in the whole country. And yet their senators, peddling really dangerous things. So you can see it's coming not just from random YouTube videos. There's actually misinformation from a lot of these leaders who are repeating these absolute falsehoods. And we're not even talking about Fox News or anything like that. So in certain ways, you can't stop these TV networks unless they're Sinclair and they're trying to air a pandemic interview.
Right. We were talking about that a few minutes ago.
Yeah, we were part of that weekend. It was a weekend binge. We found out about it, I think, on a Saturday morning, right?
Mm-hmm.
We protested Sinclair Media from airing it. Later that night, they said they would punt it and re-edit it. And later on, by Monday or Tuesday, they basically said we will table the whole interview and not air it at all. So in certain ways, media, you can pressure them a little bit. But these YouTube channel conspiracy theories, I don't know how you can stop them. In the meantime, they will just keep feeding, because they also have an incentive. The more shocking it is, the more people watch it. The more people watch it, these video makers actually get paid by per impression of people who come and watch it. So it's like this. There's an actual incentive for them to juice their numbers and juice their views with sensational content. And as for political leaders like Senator Joni Ernst repeating that QAnon conspiracy, I can't help her other than, it's for the people of Iowa to decide.
I guess we'll find out sooner or later.
Yeah.
So what's your next step? If you're dug in on the public health policy, economics, on the social communication.
Yeah, I think it's advocacy. By the way, I'm not certain about Irwin's statement that we will have these rapid tests in 4 to 6 weeks. Mm-hmm. I'm not sure. There is this argument of this off-label use and whether it can be mass-produced for off-label use. and whether it will be cheap enough, because $5 is still too expensive for mass daily testing. You need to get it down to $1. And whether we'll scale that up, I'm not sure. We need also more manufacturers in that one.
Yeah.
I'm not sure it will arrive in 4 to 6 weeks. Right now, the other key thing is the worry about the vaccine rush. And I think there's going to be a lot of discussions from your other interviewers and coming up about that. But the vaccine phase 3, you need a large full trial run to run its course to see the full efficacy. And the rush is with Steve Hahn. He's already put through 3 murky EUAs, whether it's the first hydroxychloroquine approval before the retraction, the remdesivir expansion without true trial evidence, of course, and convalescent plasma, which got him in the hot water last week. I think what they're going to do is they're going to force an EUA. It's pretty obvious what their October surprise is. No one's going to get the vaccine anytime soon, other than maybe a few healthcare workers late fall, early winter. But and to basically declare a victory is terrible, because the WHO and Richard Peters' group put out a good Lancet paper that says we have to make sure it has a minimum of 50%. And not only that, we have to have the precision, narrow confidence interval, statistical confidence interval, that it is not too low, that it's not 30 or something like that. So it must be precise enough or strong enough that avoids the lower bounds. Now, this gets a little technical thing, but it makes a difference, because say there's many vaccines being tested, but the moment you have an EUA and it's available publicly, it's going to screw up all the other trials. And in subsequent, because there's going to be pollution. People in the placebo, they don't know they're placebo. They're going to try to seek it out. It's kind of like whenever you have a vitamin trial, but everyone's already fortified for a vitamin, then you're going to screw up your tests results. And secondly, in future subsequent trials, once the EUA is there, there's an ethical thing that if something is proven to be effective, you're not allowed to use placebo anymore. So then you have to do these non-inferiority trials. And doing the non-inferiority trials becomes much more harder, because instead of doing a trial that can test the difference between 80% effective versus 0, which is much easier, then you have to test the statistical significance of difference, that you have to prove that 80% is much better than the 50 with statistical confidence. And you could theoretically fail. And instead of proving that the 81 or the one that's even better should be the standard, unless you don't succeed in showing that it's better, you basically default back to the mediocre one. So you might actually end up stuck in the mediocre treatment for a longer period of time, because you've EUA'd it, approved it, and it becomes like the standard of care. So it becomes a really, really slippery slope, and it's shooting ourselves in the foot long term, in addition to not getting the true answers we want.
Yeah. Set one last question before you go. It's kind of an overarching one. And it's about this balance of sort of freedom and top-down governance and libertarian, liberal, whatever you want to call that spectrum. Early on, there was some comparison I saw of like hospital bed per 1,000 people in Japan, all the countries around the world, and the U.S. is like 2.8, and Japan was 11 or something like that. And I was trying to make the point in those statistics that there's no simple scientific answer for how many hospital beds a country should have per 1,000 people. There are these values-based decisions, cultural-based decisions. South Korea has gotten so credited for early response, et cetera, but they're basically on war footing 24/7 in South Korea. Yeah. So they have hospitals, they have norms that are kind of different, as you said with Japan, with
they don't wait until their hospitals are full before they act.
Yes. So is there a way to have a discourse that cuts against the simple us, them, right, wrong approach to battling out, like Charles Rotter, who's very libertarian on the comments here on Facebook, is saying, well, Cuomo was lionized and then criticized, and he says, Nebraska has a low death rate. And is there a way to have a conversation that doesn't end up with people tearing hair and throwing things?
Yeah. So first of all, I think people have to realize that the cases, deaths will go up once cases spike. Midwest deaths will go up soon. I think the key thing is hospital beds. Just because they're empty doesn't mean you have to fill it, and that means and think of it this way. Look, we have bike helmet laws, we have seatbelt laws, we have airbag laws, right? We don't wait until the hospital bed's full before we act on those. We have these because we care about prevention, and libertarians should see that. Some people, there's some people who only believe something if they see it. But the way public health works is if 10 people are being killed at this busy intersection, we add a stop crossing light or a sky bridge or something like that, and 0 people get killed. That is a success that we prevented them from being killed. And no one sees public health success because the success metric in public health is nothing happened, no one died. And I think that is a function of libertarians. I think just need to realize that there are many successes in government that they don't see because they were successful and therefore nothing happened. And I think that's the kind of like the view lens I feel people should see public health and try to understand it, which is really hard. Cancer doctors, there's lots of money flowing into cancer centers because cancer is a terrible illness and it's a very visible illness. Right. And treatments that do save people's life yields a very amazing recovery for those who do recover. And it's something that you can see and hold and taste, but public health you can't. And I think that's kind of like the lens we need to see. An ounce of prevention is worth a pound of cure. But you have to put in the money for the prevention, and you have to trust that, the lack of cataclysmic pandemics and lack of people filling up the hospital is a function of our success. And ultimately, in terms of freedom, we want to go to parties. We want to have our kids going to school again. We want to go drinking in bars and celebrating weddings again. And if we just limit ourselves for now, we can get all that back.
Right.
So it's like short-term pain for long-term gain. We're always trying to teach our kids delayed gratification so that you can enjoy the reaps of our fruits later. We can get more freedom through this. If instead of dragging this out forever and we're stuck in perpetual purgatory. And I think that's the main message here.
One last very simple question Jenny has posted. It's simple in theory. She doesn't rely on any single national news source, too much propaganda. Just a citizen in the U.S. trying to find reliable numbers. One source reporting real numbers, and this is infections, hospitalization, deaths. Like, where do you go each morning for basic data?
Well, I think the data, there's aggregators. Like the Johns Hopkins one is an aggregator. And then there's COVID Tracking Project,
right, an
aggregator. And then there's people who actually use those data to aggregate. So the Financial Times has really good for graphs, coronavirus graphs. There's other dashboards, but I think the Johns Hopkins dashboard is probably one of the best. Look, these dashboards, they have no financial conflict of interest. No. They're just purely reporting the cases. And I think, New York Times has great reporting too, but, New York Times is not for everyone. I get that. But the data, for the most part, they agree. And in terms of actual cases, infections, they're probably 8 to 10 times higher, maybe even 12 times higher than what they are now. And I think there's really good resources. And And I think a lot of places like Science and Stat News also has really good resources, but there's paywalls, and of course,
Yeah.
and there's people. The other thing is, I sometimes tweet out articles that people don't read, because if you tweet it out, they'll read it. But if you just link it, people won't click the links. And so you just need to just spoon feed people sometimes into reading information. So
Yeah, it's, to me, it's almost more a habit of on the information consumer end, where you have to just sort of step back from something in the moment and say, how do I really know this? Do I really know where this came from?
yeah,
And then following people who can lead you not just to answers, but to honest explorations of questions when there really are not answers. Earlier, I tweeted while we were talking, there's this Society for Decision Making Under Deep Uncertainty. This is an actual thing. They're real people. I spoke at their conference 3 years ago, and they're trying to normalize for leaders, corporate, governmental. How do you build the capacity to look at deep uncertainty and complexity and come away with action tracks that that leave you options, that don't, end up leading you down a one-way street to regret. I don't know, by the way, I want to make sure before you go, Eric, have you met Bob Bazell, the longtime NBC? Oh God, I almost said CBS. The longtime NBC science correspondent. And Wendy Wertheimer, for decades, from the early pre-AIDS days, was at NIH in various roles. And every Friday for a while, we were doing weekly sessions. Eric, as you guys probably have seen on Twitter, has been very active, kind of making the case for rational healthcare policy in the face of the epidemic. We've spent the first hour here talking about schools, and we're going to transition to some of the tough stories in the news, some of which are about schools, and about the vaccines. And so here we go into hour two. Eric, if you want to hang, you can hang. If you have to go,
but thank you so much.
Great to see you face to face finally. We were working hard on the pandemic battle and other things.
Sinclair thing for a while, but it was good. We pulled that amazing thing off on that weekend. So
one small victory in a flood of misinformation.
Yeah.
Well, it's great that you could be on.
Thank you.
Saying what?
Stay safe.
Thank you. So for those who've been here for the first hour, again, this is the Earth Institute Sustain What webcast. It's a component of my initiative on communication and sustainability at Columbia University. This is like the 6th month. We've had 85, coming up on 90 episodes. 250,000 people have tuned in, at least. And it's a great experiment itself in constructive outcome-seeking conversation. And it's good to have Wendy Wertheimer and Robert Bazell back. And now I see John Cohen from the West Coast, who's one of the amazing reporter at Science Magazine, who has been dug in deep on the vaccination race and on so many other aspects of this, is here as well.
Good to see you all.
Yeah. It's like old home week.
Yeah.
And Eric Figgelding, who's at Harvard and going to leave us now. Eric, thanks again. Let's stay in touch.
Stay in touch.
Bye-bye. Hey there.
Hello.
This has been a while.
Hello, New York. Hello, New York.
How are you all doing? Wendy, how are you doing?
My mom used to say I'm in pretty good shape for the shape I'm in. So that's all I can say. I think dealing with the same thing everybody else is. What do you do with kids who want to be out in the world, and dealing with the news that is like I don't know whether to be irate or angry or all the above. I don't know. It's just nice to see everybody and be back together again to talk about all the craziness.
Well, I enjoyed the way this started with you. I think it was Lori Garrett who reached out to me and said, we're doing this weekly long-timers chat, and maybe we should go public with it. And we just kind of tried that out for a while. And I think it's good to sort of have the step back moments. To Corey Dean, who used to be the science editor at the New York Times, always used to say, okay, let's review the bidding. Like, when we were in the middle of 9/11 or in the middle of after the Flight 800 had crashed and we were trying to figure out that puzzle, or so many other stories that just keep going. And if you don't step back and also assess your own coverage or your own thinking, then you can really lead people in the wrong directions. Bob, how are you?
I'm okay. I haven't been doing as much journalism as I was doing for a while, because I started teaching 2 classes at Yale.
We should talk about that too.
Yeah, because it fits in with the education. Boy, there's a lot of feedback here.
Hold on.
Mm-hmm.
My dog was scratching to get out of the room.
Oh, okay. The amount of work that it takes to do an online course, and are you teaching, Andy?
Not currently. I'm trying to get a course set up for the winter semester.
It's really difficult.
Yeah.
And in ways that I would not have imagined, particularly because we went online after the spring break. But for this one, I've never met any of these students. So before, it's very different for people you know.
Right.
Than talking to strangers.
Right. That's a very interesting point. And are you finding, what's their demeanor?
They said they seem to be into it. They're excited. The majority of them are on campus. At Yale, they have a choice to be either stay home or come, and it's all online. I'm not living in my apartment in New York.
Yeah.
Even medical school first years is all virtual in some med schools.
It's such a strange feeling when you get to know people and you've never actually met them. I'm having that experience with lots of people on here, and it's odd. There was a story the other day by someone on how we're losing our human skills in fast motion. John Cohen, you had a pretty strong story out just yesterday, or did it just pop up today? I can't remember.
You said a few months ago on one of our chats that today is like May 45th.
March 35th or something, right?
March 35th. And that's how I feel. I don't know what day it is. I know the story posted yesterday. Moncef Slaoui, who heads the scientific arm of Operation Warp Speed's vaccine effort, has not spoken to media much at all, and he finally agreed to, or was allowed to do, an interview with me yesterday in some depth, and I found it fascinating because I've known Moncef for several years, and he was candid about the political challenges and some of the nitty-gritty scientific stuff that I think is pretty confusing, that no one from Warp Speed had really addressed before. So I was really pleased that he was not ducking and dodging and weaving and trying to avoid questions, but really, as best he could, addressing them head on.
Can you summarize the main points? Because this has been a pretty opaque effort in many ways.
It has been. I mean, one of the most confusing and controversial aspects is how quickly can you move and still be respecting the science and the safety and efficacy. And there is a mechanism that the FDA has, the emergency use authorization, that we've seen invoked for diagnostics and treatments already. And with treatments with hydroxychloroquine and convalescent plasma, there's been a whole lot of criticism that the mechanism was used inappropriately, and that there was political pressure that led to the mechanism being used, or at least being rolled out and used when it was and the way it was. Hydroxychloroquine, there was never strong scientific evidence to even use the mechanism, and that was revoked. And that was driven largely by Trump's enthusiasm for hydroxychloroquine. And convalescent plasma is a different story, but it probably, I think in most people's eyes who are close to it, merited an emergency use authorization, but it was announced on a Sunday evening in a weird press conference where Trump said that this was a historic breakthrough, which it wasn't. It's a potential minor advance for a small group of people, and it's fine to do an emergency use authorization, but it was politicized. And so I
Oh, it was the eve of the Republican National Convention.
It was the eve of the, exactly, sorry, Bob. I skipped I buried the lead. Yeah, it was the eve of the Republican Convention, and Trump clearly wanted to sell it as, here, look all that look at how much we're doing here. It's a historic breakthrough, he said. So I asked Moncef Slaoui, does this blowback have an impact on the potential emergency use authorization for a vaccine? Because you could be crippling sort of support for what you're doing and creating great doubt about whether what you're doing is because of politics. And he just flat out said, I'll resign if they try to push this forward, if the data aren't there. And I didn't ask him that question. He just said it. And he also said
feels encouraging in a way.
I think it is. I mean, I think he said, look, I'm in a position of you trusting me, and I take it very seriously, and I'm out. I'll walk. If I get stepped on here and pushed to somehow not have great scientific data that I'm convinced is worth the emergency use authorization, there's no way I'm going to be part of this. So I think that was a very strong statement on his part.
Yeah, it feels promising. Sorry.
Do you think his walking would stop it?
I guess we'll have to wait and see. I don't know, Bob. I mean, that's one of the fascinating things about this administration is all sorts of things happen that all of us said, well, if that ever happened, then of course,
right.
Never see this. But all these things happen and everybody goes, yeah, well, it's Trump.
Right.
So things just kind of roll on sometimes. But I do think it would send a very loud message to the public that the head scientist of this campaign doesn't believe a vaccine should be used. I think that vaccine would have a hell of a hard time going into people's arms. And it wouldn't help us. At the end of the day, it just wouldn't help us.
Wendy, what's your take on the uniqueness of where we're at now? Having been at this through the NIH lens for decades and WHO a little bit as well, looking at the vaccine struggle here.
Well, actually, the experience I think of even more is that in 1976, I was a staff person on Senator Javitz's staff on the health subcommittee of the Senate during the swine flu hearings when we had a emergency swine flu vaccine that we threw into people to some great tragedy, including a staff person from the Hill.
Wow.
So reading John's piece, it's hard to know. And Bob's question, is he being naive to think that he is going to have that ability? Has he been given that kind of authority? Because it just seems that from the FDA, from the CDC, they really have been pushed around and been able to kind of pull back a little bit, but the political pressure just seems overwhelming. I don't remember anything like that during AIDS. I know that during my time at WHO, my boss, then Jonathan Mann, we can talk about this other story, but he was actually a CDC seconded staff person who was the head of the AIDS program. And he left during a controversy with WHO. But the US government did not ever, that I recall, pressure anyone to make a scientific decision to move a drug, we never have had a vaccine for HIV. I mean, there were conspiracy theories about HIV, which we've talked about when we've been together previously, but nothing like we have now. I mean, the idea that for HIV, everybody, the message is wear a condom. Somehow masks are more controversial and more political than telling people to wear a condom to prevent HIV.
Wow.
So,
Wendy, just one thing that happened in back in the days with HIV/AIDS is the political pressure came from people who were afraid of becoming infected or living with the virus. They were
Right.
the ones who pushed for accelerated approval. They were the ones dying in
Right.
front of the FDA, holding a die-in, saying to the FDA, move faster. It wasn't the government. They
Exactly.
were the government.
Yeah.
Yeah, well, there's this bizarre business in Iowa with the governor and the head of the university just saying, let the people die. We're not going to do anything about it. And it is such an astounding, as you pointed out, John, the contrast with the people who were at risk for HIV/AIDS, who were standing up and wanting sometimes unrealistic things, but they were pushing, but not denying. The vaccine hesitancy is one thing we have to deal with, but the idea of denial of the existence of a disease is rather amazing. There was some of that with HIV. We had Duisburg and everything, but it was a really tiny part of the whole story.
So Bob, let's go back to school. Literally, you and obviously Yale is not the public school system. It's a very entire just like Columbia is not. But we're all faced the basic architecture we were just discussing last 45 minutes for school systems that are opening physically is there anywhere. Ventilation. What do you do about common areas? What do you do about tracking testing? What do you do in the community, tracking community transmission rates? That's all a similar landscape. And then, of course, in New Haven, I don't know if you have any observations just from being in
I'm not in.
Right, you're in New York.
I'm in New York, but I'm
right.
talking to the students because one of the things I wanted to find out is how safe they felt and what was really going on, and they are confined to their dorms for the first week, and then they're allowed to go out in the quad and walk around campus 6 feet apart with masks. They can't even go into town. They can't leave the campus, and they're tested twice weekly with the results coming back in 24 hours or less. So I think Yale has been pretty responsible, and they only brought back certain people like this year. It's freshmen in the fall and sophomores in the spring, so it can be on campus. So they've been very responsible, and the students don't feel bad, and there hasn't been very many cases that have been reported, and they've been pretty transparent about it. But that's one place. Certainly a lot of other places have not behaved like that, and some of them had to shut down.
Yeah. So John, you said you're working on, did you guys produce another documentary?
Oh, I'm working with David France on a documentary for HBO about the search for a COVID-19 vaccine that's slated to come out in 2022. So
okay.
Yeah, but we're trying to create the historical record of what really happened behind the scenes, and it's an interesting project. And he has a good team, and I like working with David a lot.
Oh, that sounds great. It's such an important issue.
It is. It's an interesting, for me as a print journalist. I have worked with TV before, PBS NewsHour extensively, doing projects, but doing a long-term documentary project like this is really. I'm videotaping right now. There's a camera there, and just trying to capture stuff. They're not going to use the vast majority of everything I shoot. Let's be real, but it's still fun to capture stuff. Now, I wanted to say something on top of what Bob was saying. There is a scientific way to go about opening schools, and you can test with a certain frequency, with certain types of tests, and use biomedical tools to help you. Many schools aren't. And that to me is what's startling, that what Yale is doing and several other schools, I think is very responsible. They're saying everybody wants there to be on-campus life. So let's test it. Let's see, how do you do it? And we're going to learn from this. And there are going to be schools that are extremely successful. And there are going to be schools that have giant outbreaks. And, it's over time, I think we're going to get out of this earlier than people think. I when you just said in the spring, Bob, I kind of blanched. I bet you I'll put money down that that's not what happens in the spring.
What did I say about the spring?
Well, there was freshmen in the fall, and
Well, no, the plan had already been announced at the beginning of the year, school year, that only freshmen could be there in the this semester, and then in the spring semester, it'll be only sophomores.
I bet you that changes in the spring semester, because I think I see progress. I see us figuring out how to do things safely. San Diego, now remember I referred earlier to the accordion, how we really have to figure out how to open and close repeatedly. I think we're actually learning that. San Diego opened, things went wacky, got out of control, we closed. We're opening again. Today, they're opening movie theaters here, which shocked me. I'm not going to the movies, but I think in the spring, Bob, you'll have more than sophomore there. That'd be my guess.
Well, maybe I want to ask you something about, all of you perhaps, about this question of I want to characterize this as simply as possible. That the landscape of variegation we've had in the United States, obviously it's created enormous pain and losses here and there, but if you're observing it, you do see sometimes lessons emerging from places that might not have been ideally responding to this, but then are now shifting in a way. So we've had this, and the media tend not to focus on those stories, the ones you just described, John. We don't focus on the learning or the adjustment or the risk reduction that's coming now. We focused on they're not doing this and it's a crisis and people are dying part, but not that part. Well,
the Wall Street Journal, in its news section, let alone its editorial section, has a story every day about the case numbers going down. And they make a big deal out of that. And they are. I mean, they're not reporting false information. And I think, John, a lot of what you were describing is, it seems like forever, of course, but this virus has only been around since early January. We've only known about it. And the more we learn, we know what's safe. We have a much better idea of what's safe and what's not. What we lack still is leadership from the government, right, to tell us what the best practices are now, and to tell us that how they might change expect them to change over time as we gain more knowledge. And that idea that science can change, but who would have predicted this business that it becomes a political symbol to wear a mask or to put yourself at risk by going to some nutty motorcycle gathering or those kind of things? It's just astounding.
So is there? It's almost impossible to think about a post-polarization approach to finding pathways to more resilience and less impact, given we're heading through the next 2 months into an election that's probably going to be contested, almost assuredly will be contested in some way. But if we could play the experiment, is there, have you seen outlying really good coverage, for example, or a state where an unexpected governor kind of shifted policies in ways that are producing results that just isn't getting enough attention? This is an open ball for anybody, a jump ball.
Well, Governor Cuomo here in New York certainly shifted. It's understandable with hindsight that he didn't want to close down Broadway and all the restaurants just as tourist season was beginning in New York. But there's all these numbers that have been calculated about if he had done it a week earlier, how many of that horrible number of cases and deaths that we had here could have been avoided. But now he's spent a lot of time talking about what a great job he did. So right. He doesn't need anybody to blow his horn. He does it himself. Have people shifted in other places? I don't. Yeah.
But who would have thought the former director of the NIH would write a piece saying you can't trust CDC?
Right. Well, that's
remarkable.
Wow.
Yeah. Well, I mean, you also saw Trump shift. He wore a mask.
For an hour.
Yeah, well, and he started pulling it out of his pocket, saying, wear a mask. We did see that shift, and we are in this political uncertainty. Who knows what's going to happen? I think there are going to be a lot of surprises, and on top of it, we're going to have flu show up, and as flu shows up, Lots of people are going to think they have COVID who have flu. That's inevitable. And then that's going to create a whole nother dilemma. And the masking also works with flu. It reduces flu transmission. So you're going to have another impetus to wear a mask, but you're also going to have more people wanting tests, I predict, who think they have COVID, who don't. I think we're going into November 3rd is just the beginning of flu season. That's just kicking it off.
Right.
So I think we're really, we've been living in this era of uncertainty, and I think it's going to be squared. I think it's going to be exponential. I think we're going to go from the uncertainty we have today to far more uncertainty. And then I think there's going to be, it's not going to magically disappear, but I think there are going to be advances. Monoclonal antibodies probably will come first, and then efficacy and safety data from vaccines that in the wintertime and by spring, I think will really alter, and the testing improving, and the simplicity of the testing and the frequency of the testing. And the contact tracing in San Diego is excellent. And the story today about how that drove down our numbers, that's going to improve in places. I don't think we're going to get worse and worse and worse in terms of our response. I do think there will be a seasonal impact on COVID-19. It will probably take advantage of our winter. We're going to have flu and other respiratory diseases kicking in. But all in all, I think there's going to be this, wow, we popped out of it. And I would predict that's going to be around the spring.
Well, let's mark the calendar. We'll revisit. Even that's a pretty encouraging landscape you created there, because you're talking about treatment, you're talking about responsiveness, contact tracing, and the vaccination eventually. So much of the conversation seems to focus on vaccination. Is this like magic bullet?
Vaccines are just going to be a part of it, but we are. I mean, I'm just not all doom and gloom, because we've been through these before. We are going to get out of this, and it's going to happen slowly. But then when it happens, it's going to be fast. That's the thing. It's going to take a while till we get there, but when we're there, boom. I mean, if you look back at HIV/AIDS, there was no good treatment until the end of 1995. We started to get a signal that stuff was working. By 1996, it was front cover of every magazine, lead news story at the AIDS conference that year in July in Vancouver, lead news story every TV station. And boom, for the rich world that could access these drugs, epidemic changed. It didn't end overnight, but it no longer was a death sentence. And that was just a hammer fell. That's what happened. And it took a long time to get there. But once you're there, you're there. And I anticipate something like that again.
What do you think about that, Wendy?
Too cheery for Wendy.
I hope you're right. I don't share your optimism about the infrastructure that will allow that to happen. We're pulling out of WHO. We're trying to destroy Obamacare. We don't have a Ryan. I mean, do you think we would have a sort of Ryan White type program where we're going to help people who can't afford those treatments pay for those treatments? That we had for HIV, because we had, as you said, this most remarkable activist group who brought along their members of Congress who fought for all of this stuff. And I worry that COVID disproportionately right now is affecting people who don't have that kind of political power. It's affecting minorities, it's affecting frontline workers, it's affecting people who couldn't do what we're doing and work from home. And in the intervening time between now and when these drugs, God willing, become available, sort of what's happened to an awful lot of people, and what has happened to our infrastructure. I don't know. I hope you're right, though.
Well, one of the things, Wendy, I think I agree with a lot of that, but a lot of it's going to depend on the election, and
True.
Not just the election results, But whether we have chaos that could, in mind, as some have warned, lead to the end of our democracy, and it's not an exaggeration to say that that's a real threat. Now, I'm threat. I emphasize threat. I don't think it's going to happen. But after that settles down, after we know who's president next, I think we'll have a better idea that all the things John was saying, I think, are going to happen. I mean, we're going to have better treatments, better testing, and ultimately a vaccine, probably a vaccine, as always, iffy, as John knows better than anyone. But even really good frequent at-home testing would make an enormous difference. And it will come eventually, because it's just a matter of will. But until we get through this election and the craziness that's spewing out of the top levels of the administration, and the complete defanging of the CDC, which has this enormous amount of knowledge, and of the lower level echelons of the FDA that does as well. Until we get through that, it's very hard to see these things coming in an easy way. I think they will come one way or another, and for certain people and not others, for sure. But it's going to be tough until we know.
Yeah, I actually agree with what both of you said. I do think access and equity are going to be huge issues with any biomedical advances. And as we saw with HIV, the drugs that worked in 1996 didn't get to most of the world that needed them badly until starting in 2003. So there was a 7-year delay to even start that massive rollout. And I think we're going to see struggles right and left to get things out to people who are less advantaged, privileged, wealthy, whatever it is. That's inevitable. But I'm just talking about that moment in time when we finally have the tools. That I think that's going to be like one day, wow, they're here. That's what I'm getting at. Those tools are going to go forward. And there is a lot of effort right now to make sure that things will be freely distributed in the United States. The way it stands right now, the US government has purchased vaccine to give away, not to sell. So that's a positive sign. And I agree wholeheartedly with Bob. Who knows? This whole country could be torn in half. There could be something akin to a civil war. I mean, we have never been so divided in my life. I've never seen, this sort of rancor continue day after day after day. And we have a common enemy. We have a virus that is an equal opportunity, or it tilts towards some populations, but we're all scared of it, and I don't have any sense of calm about our political future. I think it's, who knows?
And that's why it's good to just say hi once in a while.
Yeah. Well, there was some, and I'm sorry, I forget the organization now, but they're a widely respected organization headquartered in London that measures world threats. If Lori were here, she would know exactly what I was talking about. But starting in 2016, this organization, which gives out a yearly threat assessment for the world, and of course, global warming and catastrophes or pandemics are always on the list. But the number one thing they said was a threat to the entire world would be a close U.S. election in 2020. And here we are. And it's just, I can wake up in the morning actually shivering about it.
Well, I wanted to ask, go ahead, Wendy, I'm sorry.
No, sorry, Bob. The other thing that is unique to me about this time, and it kind of is this thread I now pull through, starting with the article in the Atlantic yesterday of the president disparaging members of the military, to the president actually saying that he felt that there were people in the deep state at NIH and the FDA and the CDC who are deliberately slowing down progress in science because of the election.
He said recruitment to the vaccine trial.
Sorry. The idea that federal employees, that public servants who have dedicated their lives to saving other people, who are civil servants. The notion that the White House feels that way about government workers, whether you're postal workers or the military or HHS or anyone else, is also so unique for this time. And as the science progresses, John, I just, that's one more thing. The White House, I don't think, has any appreciation of, the commitment Tony Fauci has made to 50 years in the government. He sort of said, well, I inherited him. He's been here forever. I do think that makes this all so much more treacherous. That aha moment, I worry is, it kind of not going to be as joyous as it ought to be.
Well, there's not going to be dancing in the streets on that day. And, there's this really odd thing that I think about a lot, where we all want what Donald Trump wants. We all want a vaccine as quickly as possible,
right,
that's safe and effective. We all want drugs that work. We all want case numbers to go down. We want what he wants. We're not debating, should we go to war in Afghanistan? There's no debate. We want the same thing, but we don't want false hope. And, we don't want to get ahead of ourselves and have a boomerang where we hurt ourselves because we do something rashly. And we know from the past that that's easy to do with biomedical stuff. You can hurt yourself. And so I find this weird tension between, I want what he wants. Give me a vaccine. Give me good treatment. I just want it to be real. And
right.
Yeah, but he gives off messages with science and medicine that are akin to telling people to vote twice in North Carolina and elsewhere. And as a result of the continual lying and distortions, it just, and the realization for those of us who are not Trump supporters, that the number of people in the United States who just love this stuff to death, love poking his eyes in academics and
yeah,
the so-called elite. It leads to a kind of terror in my soul, but I can only speak for myself.
Bill Hasseltine told me many years ago that one of the strongest human emotions is hope. And if you can sell hope, you can become a multimillionaire. And
yeah, there you
Trump
go.
is constantly selling hope.
And now he's awarded a $250 million contract to do that.
Oh, I don't know, the hope contract?
The contract that HHS is letting to a PR firm.
Yeah, Wendy, who's getting it?
Oh, I
Who
missed
is
this.
the
Tell
PR
us
firm
about
that's
this.
getting that?
They
Tell us about it.
I can't remember the name of the PR firm.
Was this
You
covered
don't know
by,
them, or you?
was this covered
Do
by
you-
somebody?
Oh, it was covered by everybody, but do you know, Wendy? Because you know that world. Do you know the people that are getting the
No.
money?
I don't. I never dealt with them.
Wow. I've been so immersed in other fronts that I missed this. I'm going to show it on screen in a second. It's certainly an interesting strategy facing the infodemic, just to sell hope.
Well, the biotech world has long had people make lots of money based on hope. You don't have to have a product come to market, right? Bob has written a book about it.
You're right.
Amazing.
There you
About
go. I was just doing that.
Well, I wanted to ask you something too that is a little weird, but you got stuck on a sailboat some years ago, right? And got lost at sea. And
Yes.
Talking to me or who?
Bob
Me.
Bazell, got lost at sea. I wonder how this compares to the feelings you had when you were lost at sea.
Well, that was the most awful thing that has ever happened in my life, and I got separated from my family, and it's really a horrible, horrible time. So it's a uniquely horrible event that it's difficult to compare to politics or anything else. So I don't know what else to say about that.
Okay. I just think we're kind of lost at sea right now. But when you went through personally, I can see that's an insensitive comparison. Sorry.
No, I didn't. I don't take it that way. I'm just saying that it's very hard to make the two things different. it's very hard to compare the two things
I will
because
say
we're
that.
talking about.
Yeah, sorry.
Go ahead. I'm sorry.
I spent a couple of years on sailboats when I was much younger, and had been lost, not in peril. I ran onto a reef in Maine, and one example, and we actually ran onto a sandbar in a storm in Greece on a big boat where I was at the wheel in the middle of the night. And there is a certain maybe that moment was kind of like right now, because here's the moment. I'll just Bob, every experience is unique, so we'll respect the intensity of what you were talking about. But I was alone at the wheel on a 55-foot sailboat, 1 o'clock in the morning. We were sailing in western Greece through the Corinth Canal, and it was pitch dark, and the wind was coming up behind us. There was a pretty strong gale developing. The rest of the crew was asleep, including the owner of this boat. I was just a lonely, schlepper. And we didn't have a good map. We didn't have a good chart. We had like the cheap chart, which was for all of Greece. We didn't have the detailed chart for the bay, the Corinth Bay there. And I couldn't signal anyone down below. They were all asleep. And I had to make a judgment at one point when I saw a light up ahead on a buoy. Do I go to the port or starboard? Which way do I go? And I had to guess. And I guessed in one direction because I knew it reduced the risk of the sail ripping apart in a jibe. And I guessed wrong. And suddenly we could feel the boat thumping, flump as we were going into shallow water on a sandbar, the Missolonghi River. And I'm just literally feeling this incredible sense of despair, because in deep uncertainty, with inadequate information where I could have had better information, I made the wrong choice. And we ended up wrecking. Well, the boat survived and no one got killed or anything, but it was pretty epic. But there was it had some of those characteristics: lack of data, economizing, so you didn't have a perfect sense of the landscape, the seascape, and having to make a choice. So that feels a little bit like what you're talking about.
I'm curious how much you all have opened up. I mean, we have started to have, dinner parties on the deck with some regularity. We don't let people in the house who don't live here. For the most part, we make a couple exceptions. But how are you guys handling it at this point?
Pretty much the same. In New York City, there's still no indoor dining, and we have dinner with friends outside. And particularly, it's interesting because everybody makes their own decisions, but because of a lack of guidance, there are some bars and restaurants where people are really crowded together, and particularly they're young people and they're screaming and yelling without masks on. But there's other places where they really make a lot of effort to have safe environment. They have plexiglass between the tables and things like that, and that feels fine. So outside, walk in the park, have lunch in the park, whatever. That's all good. A few people, children come over, but not anybody else. And occasional repairman. When the refrigerator broke down, a repairman has to come, or you can't live without a refrigerator.
You weren't grocery shopping before. You were having all groceries delivered.
I have not been in a store since the 1st of March. I haven't been in any. Wow. I haven't been grocery shopping. I haven't had a haircut. I haven't done anything. Kids kind of come and go. They have their friends outside and meet them outside. We're actually going this weekend to sit outside at a friend's to have some drinks, but they've been rare. I have not been to a restaurant. We have takeout constantly to try and keep our favorite little places in business. But we've been pretty ostracized, I would say. And honest to God, I don't get bored. There's plenty to do, and plenty to keep track of. So I don't feel the need to be out there right now. We haven't traveled at all. I don't know about you guys if you've.
We drove to Maine to see my mother-in-law, who we hadn't seen in over a year. And it was interesting. Maine is a divided state. She actually, this was pretty telling in the context of the pandemic. She lives in very rural down East Maine in a tiny lobster port, Winter Harbor. And for her, the pandemic was, completely abstract. And you look around there are signs on some lawns say, what's that phrase that, deplorables for Trump. In other words, people who are proudly for Trump because they were labeled deplorable by Hillary. And there was a few signs for Biden. And then what happened was that that outbreak at the wedding in another part of Maine, far from her, by Maine standards, touched her because a close friend of hers is the daughter of the woman who died from the flower vendor getting the flowers to the wedding, took back the illness, and it ended up touching her circles in this tiny village in the middle of nowhere in Maine. So that was pretty interesting. That was while we were up there. So that I remember right at the beginning, February, I think it was Lori who said, you're in a pandemic when everyone knows someone who was sickened or touched by this in some way, and that I think it's getting out there in that sense. It was pretty powerful to see that happen.
We took a family trip in June. We had all 3 kids who are all adults now, essentially. And we drove up the state of California. And then the state was just opening up, like everything was just opening up. And then everything shut down like the week after we did the trip. We couldn't have done the trip a couple weeks later. But we're about to drive one of our kids to Santa Cruz, where he's going to go to school in a couple weeks. So we're going to take a trip up the state. But I haven't been on an airplane or, left the state of California the whole time, which for me, I travel 25% of the year and travel to every continent. This is the longest I've been stuck ever in my career. And I'm so glad I've had the opportunity to travel a lot in the past. That's kind of how I look at it. I am itching to get out of here, and I've been trying to organize some trips for work, and the people I want to go visit are the ones who are blocking it. So
that's interesting.
Yeah. But my family's in a very interesting place also, because I have a 90-year-old mother who regularly comes and stays with us. She lives in LA, we live in San Diego, and she comes for a week every month or so. And we've had her here twice. And it's been frightening because my kids are, they practice social distancing. They practice socializing, and they're very good at that. And it was frightening, frankly, having my mom here, but also very worthwhile for her. So we gambled, took the risk. And she wants to come back in a couple weeks.
Yeah, well, by spring, I guess, if things go right, if the political context is not imploding, and John's prediction is being verified, there could be a lot more of that. I guess for me, my metric is my Sunday sessions, where I all these musicians I used to hang out with. We've been doing it virtually. I'll just show you this is how I stay sane and connected when
I think I've heard her and Rick sing
with
that
my
tune
musical
too,
friends.
too.
I think you can hear
you're so
it.
right about, man, that song resonates.
So there's
about,
a friend of mine is here singing on a sailboat.
some of the music you play. Can we
Whoops, where is she?
years living and sailing the world on boats when I was a very young person, and
I'll just go to one of the
it was
musical
an
sessions. It's
extraordinary
so much
experience.
fun.
And that's
And this guy is an energy and climate wonk at the Resources for the Future, who I never would have met, and he's been on my show. So there's some good aspects of the shutdown. It's kind of cool.
I realized I had to get a.
So, but we still I have friends 5 miles away from here, and we could actually do this in the backyard from a distance, but I haven't done it yet. Maybe that's that loss of socialization, or that we were talking about a little earlier today. There was a story in one of the major newspapers about how we might be losing some of that interpersonal skill because we've been so 2-dimensionally connected to people lately. But it's like I could do these now in a backyard, but I haven't done that yet. I don't know why.
I play in a band too, and we stopped practicing in March. And we've talked repeatedly about a backyard get together, but we're afraid singing is scary. It's
right.
like the best ways to transmit. So
right, there was a study of that with choirs, right?
There was a big outbreak in Washington State choir.
So John, I should get you on the show, the Sunday show.
One of the things I find most satisfying about playing music is playing with other people, and Zoom it doesn't work.
No, you can't. Once in a long while, we've had one where it actually did work, and it's kind of cool when it does. But it's totally.
But thinking
limiting.
about the thing in the backyard gatherings is we've all expressed this in different ways. You do what you think you feel safe, and of course you're always taking some risk if you walk out of your own house. And we all pretty good at making it. We read the literature to know, but it's always a gamble. It's a gamble to go to the. I'm going to a restaurant tonight with friends outside on the sidewalk, and it's a gamble. It's more than staying home, but the satisfaction of having dinner with old friends is worth it to me to take the risk. Now, of course, if you see me in a hospital on oxygen, and I might have a different view of my decision afterwards, but it feels pretty safe to the places where we've been going.
And everyone, the first hour of this was all about schools, and getting back to that, it's kind of the levels of uncertainty. You know, some general principles of what to do, what to track, and having regular testing for teachers, staff, and students. But ultimately, kind of as you just said, Bob, it's kind of like me at the tiller of that boat. You got to just go left or right.
Right.
Some of this is going to be deeply uncertain, and people are going to be acting in that atmosphere.
One of the most confusing questions scientifically is, if you've recovered, how long are you protected? And combine that with the question of herd immunity. And those questions just keep swirling around because they're so very confusing. And we just don't know. But I wrote a story this week about a really fascinating, one of the things that happens with any new disease that gets intensely studied is you kind of do a fantastic voyage into the body and look at mechanisms that have been kind of ignored. And so one of the mechanisms is, what is durability of immunity? What does that mean? And some vaccines, like the measles vaccine, they last for a lifetime. Some vaccines, like flu, they last for 3 months. For leaving aside the fact that they aren't that effective to begin with anyway. They fade. And what is durability of immunity? What actually controls and drives that? And I've had an insight from reading these papers over the last few weeks that's really opened my eyes up to something that I never fully appreciated. We talk about immunologic memory. It's this lovely metaphor, memory. We have memory. Well, what's memory? Memory is you have a population of cells that can recognize something because they've seen it before, that can rapidly expand. And then in the case of antibody production, let's say, can pump out loads of antibodies against that specific enemy because they know it. But for durability of immunity for SARS-CoV-2, it might have less to do with that than another type of cell that isn't really a memory cell that just constantly pumps out antibody. And that type of cell, it's called a bone marrow plasma cell, just now is coming into sharp focus in terms of importance of memory or durability of an immune response, because it's not really memory. It's not recalling anything. It's just constantly pumping out antibodies. And you need high level of antibody in your mucosa at the time of infection to stop it. You don't have time for that memory response to kick in. So this has really altered how I'm thinking.
Well, one of the things that's, do you, John, or any of you listen to the virology webcast? Those people are really good.
This week in
And
virology.
This week in virology. And one of the things they mentioned in an episode I was watching a few days ago was they had that up to now, very few vaccinologists were immunologists. That most vaccines had been discovered by trial and error by people who didn't know a whole lot about immunology, and the immune system is so amazingly complicated that we're learning things about it every day. And John knows of all this, of course, but it's still like the things we were just talking about. In my lifetime, I have a piece of paper that's signed by Ronald Reagan that says that I have a degree in immunology, and I have no idea. I mean, when I was in graduate school, we were B cells and T cells were just being discovered. That there were even that kind of difference in the immune system, and the people that developed vaccines. If you look at the history of vaccines, they really didn't know what they were doing. So now we have these people who are making vaccines, and trying to reverse engineer them from knowledge of the immune system. Well, it might work, but we have to be very humble about admitting how little we know.
It's a very good. I mean, the first vaccine for Edward Jenner and smallpox, and he's a country doctor who realizes that the milkmaids who get cowpox don't get smallpox. So he takes goop from the Sarah Nelson man, puts it into a little boy, and then tries to infect him. And that's how the vaccine's discovered. There's no knowledge of an immune system, let alone fine understanding. And the immune system turns out to be, to me, it's kind of like particle physics. It's just wildly complicated.
Right.
All these mysteries. And so now we're asking these questions. How durable is the immunity? Well, Bob's exactly right. We've had all these people make vaccines for a very long time who didn't really need an answer to the question. Make it work. If it works, great.
There was a story within the past week of self-administering vaccine. There are researchers who are doing limited testing with friends and themselves. Have you written on this or tracked this?
Yeah, Antonio Regalado, Technology Review, broke this story a while ago, and then the New York Times redid it so there are now 3 groups that have done it. And there's a long history. Larry Altman, the former New York Times reporter, wrote a book called Who Goes First about the self-experimentation and people who vaccinate themselves with vaccines they make themselves. There's a long, long history and tradition in medicine of doing it that was kind of noble, of people saying, well, I'm going to try it on myself first. But this movement isn't noble in that sense at all. It's people who think they're going to protect themselves with homemade concoctions. Good luck.
Well, it's interesting. I showed my class the movie Contagion from 2011 that Lori was an advisor on, and asked them to think about the difference between what that prediction of a contagion was to the real thing, which is a fascinating exercise for students. And one of the at the end, obviously they had a lot of scientific advisors, because they talked about Barry Marshall, who was this guy who nobody would believe that ulcers were caused by bacteria. That everybody thought they were caused by stress, and he drank a concoction of this bacteria, Helicobacter pylori, and gave himself the beginning of an ulcer, and then won a Nobel Prize for doing it. And all this is brought out in the movie, which I found an interesting connection to the real history of science. I recommend that movie very highly for those purposes, by the way, because what they got right and what they got wrong is a very good way to look at our current situation.
Yeah,
because they got a lot of things right in their predictions. A lot of things wrong. One of the things they got wrong was that, in fact, as soon as they made the vaccine, as soon as they were able to make the virus grow, they made a vaccine in a few days. But that's another story.
Sarah.
Yeah, well, that exercise of the exercise of taking a work of fiction and deconstructing it that way is really a cool one. Someone on Twitter was recently asking for films around climate change, and for her students to watch and critique. And I said, Day After Tomorrow. And even though it's complete exaggeration of deep freeze from abrupt climate change, to me it's a great learning opportunity, just as you just described. and it's been actually a lot written about that process. So, Bob, I might want to see if you can entice some of your students to come on the show and do a little presentation around the critique they did. It'd be kind of fun to think about that.
Sure.
I've done that kind of thing sometimes. Wendy, we have a few more minutes before 2:00. What's your next week thinking about? Or is this all about the election until it isn't? Whether that's November 4th or January 35th?
Well, I'm curious what you guys think about the withdrawal from WHO. I mean, as a former WHO staff person, I mean, if they're going to recall all those people and reassign them, at least when I was there, now that was decades ago, there were a lot of HHS, CDC, NIH staff who were working at WHO. I just wonder, in terms of our whole global health profile of all the things that we have stood for, and whether it's polio or any of the other programs, how do you see the impact of that? And whether, I mean, I guess the election could have an impact on that as well, since we can't really withdraw until next year. But I think it kind of is under the radar a little bit as a story, and I just thought it was heartbreaking. Not that WHO is the greatest organization on earth, but in terms of what the U.S. has stood for within that structure, I thought it was just really sad.
I don't
Well,
think
it is Trump.
Go ahead, Bob.
I'm sorry. It was Trump said proudly the era of globalization is over and the era of patriotism has begun. So what that means for our country is frightening to me. You're right. And Peter Piot was asked. It was on our broadcaster, whether he said it someplace else, that if you get rid of WHO, you're just going to have to build something else with the same people. That'll be just as imperfect because you have the whole world involved. Mm-hmm. But you can't do anything without the whole world involved about things like contagions that spread around the world. Ooh.
Yeah. So I would love it if we could fairly regularly resume this as sort of at least a sporadic Friday review. Doesn't have to be every week, as needed. When someone has a big story out, or if you have something to think about, I'd love to reconvene this coffee clutch, whatever you want to call it. And Lori, when she has a microsecond, can try to come back on again. It's been really good to get to know you better than I knew you before. Wendy, and we hadn't known each other at all, I think, before. So we're at the end of the hour, and I thank you for being part of this again. Bob Bazell from NBC News for a long time, and now Yale University. Wendy Wertheimer, many decades, congressional staff, WHO, NIH, deeply dug in on policy around the issues like this pandemic. And John Cohen, doing amazing work at Science Magazine. I'm glad Pulitzer Center is supporting that track.
I'll send you later for those kind words. Thank you.
It's so troubling to see journalism imploding in the middle of this epidemic, and it's anything that can be done to sustain that capacity, which is part of what we're working on here too. So I'll just say this is the Earth Institute Sustain What webcast, which is an effort to cut through the noise and get some directional conversation around really tough problems, to engage people on pathways towards solutions, even amid deep uncertainty and complexity and consequence. I'm Andy Revkin. We'll be here on Sunday doing the next round of our music session, usually on Mondays, if I can catch up with my schedule. Mondays, 1 p.m. is a skill building webinar. Wednesdays we'll be back into policy, and Fridays back on the news and media. I'm going to close right now with something that came up because we were talking about music, and it's a song, one particularly wonderful moment in one of our musical sessions on here on Sunday, and it's Reggie Harris, a songwriter, performer, who I've known for a very long time. He had just written a song called "We Will Not Rest." So listen. Let's hope this works. I think it should.
We will not rest till the storm is over. We will not lay this burden down. We will keep each other strong. We will love and carry on till we stand all together on solid ground. We will not rest till the storm is over. Hey, we will not lay this burden down. We will keep each other strong. We will love and carry on till we stand all together on solid ground. It's been a long, hard journey on a winding road. So many have gone before us. They carried a heavy load, but they went there singing as they made their way. And it's in their footsteps we follow as we work today. We will not rest till the storm is over. Hey, we will not lay this burden down. We will keep each other strong. We will love and carry on till we stand all together on solid ground. I know that you're weary. We all feel the pain. The actions of the world will try your soul again, but I know there's a better day, and it's coming our way. That's why we're raising our voices as we work today. We will not rest, oh, till the storm is over. Yeah, we will not lay this burden down. We will keep each other strong. We will love and carry on. We stand all together, solid ground. All around us there's hatred. All around us there's fear. Violence touches our lives, and the message is clear. We mourn our martyrs. In our hearts they'll stay. Then we'll sing, we shall overcome, and go on our way. We will not rest till the storm is over. Yeah, we will not lay this burden down. Yeah, we will keep each other strong. We'll love and carry on till we stand all together on solid ground. Till we stand all together on solid ground.
Hey.
So maybe I'll end every show ends henceforth with that. It was a particularly wonderful moment. And I see, John, you have your guitar out. You have to
Yeah, playing along with it.
You'll have to learn it. And I'm gonna have to talk to you about Sundays. We'll figure that out. So thank you again for being here today, and
Thanks,
to the people who are tuned in online. Share this as soon as we're done, and take care. Be well.
Bye-bye. You too.
Enjoy every day.
Stay well.
Bye bye.